we've been working with the association, and we want people to. My uncle just passed away earlier this year, and he suffered from Alzheimer's. And one of the things that we have to do is remove a lot of the stereotypes.
Yes.
Number one is it doesn't happen just because you are up there in age.
No, it doesn't.
And there are ways that you can mitigate this if you catch the signs early on. But you have to and we know that it doesn't only affect the person that is coming down with the Alzheimer's. And it also affects the family a great deal.
Yes, a great deal.
So, we want to make sure that family, what we've been doing is that we've been reaching out to a lot of families, and we've been holding forums. We've been having these conversations and just educating people to get tested early.
Yes.
So we work with the Alzheimer's Association, with the foundation, with the Alzheimer's Association, and we're just getting the information out there so that people know. Look, if you catch it at a very early age, there are ways, and I'm not a doctor, but there are ways. My job is just to get the information out there and bring people in, but there are ways out there for you to be able to manage this. There's no cure, unfortunately, but there are ways to manage it so that at least you could have it so that the effect is as minimal as it can be to the person who's affected by it, as well as the family members.
It is probably the most devastating to have a front row seat to. That Alzheimer's disease is wicked. What happens to your loved one who they are no longer as you once knew them. The education is not in depth enough anywhere for family members to be able to handle this. Yet we think we can. But that's the compassion that we have. It's our loved ones. It's our, we're not going to throw away a loved person and put them under lock and key just because they're sick. No, there are a house full of us, and we're going to take care of grandma.
It's cultural.
It is cultural.
Yep.
But you know what? We're not skilled in nursing or in the medical thing. And unfortunately, one of the declines that I see is because the family members are trying to manage this and they can't. And it's a hard conversation to have, let me tell you. And I worked in hospice as a chaplain, and talking to a family about when it's time to place a person on hospice is no different than talking to a family about when it's time to, okay, mama needs real care now all of the time. You can't stay up 24 hours.
Right.
And so, I'm glad to hear you say this. What is your dream initiative that you would really like to see happen in the health and wellness space in the Bronx?
Whoa, you got me. My dream initiative.
Yeah, an initiative that you'd really like to see implemented and that would have a huge impact on everyone in the Bronx for the better.
So I don't know how to answer that with one question, but
we don't have. It doesn't have to be.
But I would do it in the educational system. Not only in the Bronx, but throughout the city of New York. We have to get to a place where our kids at every level have playgrounds, have phys ed. Phys ed is mandated. X amount of hours is mandated in the city of New York, except we violate that as a city every single day, where the majority of our students are not getting the required amount of physical education on a weekly basis.
Yeah, they don't have to have it every day anymore, right?
They're supposed to. They're supposed to have an X amount of hours or periods, and that's in violation, in the majority of the public school system. And the reason is that the space is not there. We need to do better around gymnasiums. That's the reason why I've allocated a lot of funding towards gymnasiums and playgrounds. We just started winning the fight of getting cars and trailers where kids were being taught outside, off the playgrounds. We've had to have that tough conversation in the city of New York where we have to give our playgrounds back to our babies.
Okay.
So when you look at sports,
yeah,
and the lack of intramural sports in many of the Black, Latino, and poor neighborhoods throughout the city of New York. There's a whole campaign going on. We spoke about young people getting involved in civics. There's a campaign called Fair Play, and it's been generated and started by Bronx kids, where they've done the data. In some of the affluent community or schools in the city of New York, the kids are exposed to about and they can participate in about 25 different sports.
Oh.
In many of our high schools, in some of our neighborhoods, they're luckier if they are exposed to 2 or 3: basketball, football, so on.
And you know what? And